Thank you for raising that question. I do want you to know that the faith-based community has been very active in Richmond, talking to lawmakers precisely on this morality question. You know, SALT, Social Action Linking Together Network, which I think comes out of the Catholic Church community, the Greater Washington Jewish Relations Center has been active. There have been a number of Protestant associations and groups that have gone down to Richmond. So there is an acknowledgement that we are our brother's keeper. As a society, we've already admitted that we have a moral obligation to providing care, which is why the care is provided at the emergency rooms. Our community hospitals, our public hospitals, they are not going to deny somebody care because that person doesn't have insurance. They're not going to do that. So the argument that I think the faith community is making, and rightfully so, is why aren't we more rational about this? Why aren't we doing this in a more efficient way, and in a way that actually would give us better patient outcomes? Because when you have a patient who waits until the condition is the worst and goes to the emergency room, they're not going to get the best patient outcome because the conditions progress to the point where perhaps it's not reversible, or the medical profession couldn't intervene in time. And then that person has the unfortunate situation of perhaps having a diminished ability to go out and raise money and support his or her family. I have a couple situations of that in my district where individuals waited too long to go to the emergency room because they didn't have money to go to a doctor, and ended up in very serious situations, which could have been preventable, which were preventable, could have been avoided. So yes, that conversation is there, and to the degree people have open eyes, open ears, open hearts, it's going through, it's penetrating, but on a certain level it's not penetrating. So I don't know what else I can say.
Sure. Let me just say, you're absolutely right, and that conversation is being had, but we're all victims of Stockholm Syndrome, in that we're all thinking, but how can we convince our colleagues to change? And the discussion's been focused on trying to meet some of the objections from Republicans who would say that, oh, it's big government programs. We had Senator Favola and I saw on the floor of the Senate someone claim that this was welfare expansion for 400,000 Virginians. And we both stood up and talked about the human element that day. But
and the fact was wrong, by the way.
Yeah, it is wrong.
It's incorrect.
It is wrong. It's 70% of the people are working people and getting, at least in the Senate proposal, insurance through a private policy. But what we need to do is also focus on how we're going to turn the discussion around. And I just want to appeal to people here while I have a moment, which is a lot of people here belong to groups, to networks, whether it's your church, whether the elected officials belong to VACA or VML, whether you belong to AUW, League of Women Voters, whatever your network is, where you have influence with people in other parts of the state, or the Commission on Aging, to talk to people in other parts of the state in similar groups, to talk to their legislators. That is how we're going to start to penetrate. That, and also Dr. Lee and Secretary Hazel and Don have been doing a lot of appearances the administration has with the governor around the state to make this case in the media in each of the in different areas. And I suspect that your colleagues and you are also in Southwest Virginia, and I know the governor was. So I just wanted to say that that would be really helpful.
We have time for 2 more quick questions. Yes, ma'am.
I've spent 25 years consulting